What if I told you that the next time you feel short of breath, panicked and struggling for air, there's a simple 3-minute technique that can restore your breathing, calm your nervous system, and potentially save your life? Right now, millions of people over 50 are experiencing terrifying episodes of breathlessness and responding in exactly the wrong way, making the situation worse and even dangerous. Meanwhile, respiratory therapists and emergency medicine doctors know a powerful 3-minute intervention that stops these episodes, opens airways, and restores normal breathing, but almost nobody outside the medical profession has ever heard of it. This isn't about preventing breathlessness, though this technique does that too when practiced regularly. This is about what to do in the critical moments when you can't catch your breath, when panic is setting in, when you feel like you're suffocating. Most people respond to breathlessness by trying to take big gasping breaths, by tensing up, by panicking, and all of these natural reactions actually make the situation dramatically worse by triggering more airway constriction and creating a dangerous cycle. The 3-minute technique I'm about to teach you does the opposite, and it works so effectively that paramedics use it, respiratory therapists teach it to their patients, and people who learn it describe it as life-changing. In the next few minutes, I'm going to teach you exactly what to do for 3 minutes when breathlessness strikes. I'll explain why it works so powerfully when your natural instincts would make things worse. I'll show you how to practice this technique when you're breathing normally so it becomes automatic when you need it most. And I'll reveal why doing this technique daily, even when you're not short of breath, can reduce the frequency and severity of breathlessness episodes over time. This 3-minute intervention has helped thousands of people regain control over their breathing and their lives. It could change everything for you, starting with the very next time breathlessness strikes. If you're over 50 and you've experienced that terrifying feeling of not being able to catch your breath, you know how frightening and helpless it feels. Maybe it happens when you exert yourself physically. Perhaps it strikes randomly, sometimes even when you're resting. You might wake up at night gasping for air. Or maybe you have chronic lung conditions that cause regular episodes of breathlessness. Whatever the trigger, that moment when you can't get enough air is one of the most frightening experiences a person can have. Your heart races, panic sets in, and you feel like you might suffocate. Here's what makes breathlessness so terrifying and dangerous. When you can't breathe properly, your natural instinct is to try harder to breathe. You gasp for air, taking quick, shallow breaths. You tense all your muscles. Your shoulders rise toward your ears. You might grab onto something for support. Your eyes go wide with fear. Every fiber of your being is screaming to get more air. But here's the cruel reality. All these natural, instinctive responses actually make breathlessness worse. The gasping breaths don't fill your lungs properly. The muscle tension restricts your chest expansion. The panic triggers your sympathetic nervous system to constrict your airways even more. You end up in a vicious cycle where breathlessness causes panic, panic worsens breathlessness, and the situation spirals. Most people dealing with breathlessness have never been taught what to actually do when it happens. Their doctors prescribe medications for underlying conditions but rarely teach the immediate intervention techniques that stop an episode in its tracks. They might have rescue inhalers for emergencies, but they don't know the breathing technique that makes those inhalers work better and sometimes eliminates the need for them entirely. They suffer through episode after episode, feeling helpless and terrified, not knowing that there's a simple 3-minute technique that could restore their breathing and calm their panic. The technique I'm about to teach you is used by respiratory therapists with patients who have severe lung disease. It's taught to people with chronic obstructive pulmonary disease, asthma, heart failure, and anxiety-related breathing problems. Paramedics use it to help people in respiratory distress before medications even take effect. It works by interrupting the panic cycle, opening airways that have constricted, promoting efficient gas exchange, and activating your body's natural calming response. People who learn this technique and practice it regularly describe feeling empowered instead of helpless, calm instead of panicked, and in control instead of at the mercy of their breathing. Let me explain exactly what's happening in your body during breathlessness and why this 3-minute technique works so powerfully when your instincts would fail you. When you become short of breath, several things happen simultaneously. Your airways may constrict due to inflammation, mucus, or bronchospasm. Your breathing becomes rapid and shallow, using only the upper portion of your lungs. Your chest and shoulder muscles tense up, restricting the expansion of your ribcage. Your nervous system shifts into fight or flight mode, which further constricts airways and increases heart rate. Carbon dioxide builds up in your blood while oxygen levels may drop. Here's the critical part most people don't understand. The sensation of breathlessness isn't always caused by lack of oxygen. Often, it's caused by a buildup of carbon dioxide and the inefficient breathing pattern you've fallen into. When you take rapid, shallow breaths, you're moving air in and out of just the upper airways without properly ventilating the lower portions of your lungs where gas exchange actually happens. You're working very hard to breathe but getting very little benefit. Meanwhile, the panic and muscle tension are making everything worse by restricting airflow and increasing your body's oxygen demands. The 3-minute technique works by reversing all these problematic responses. It slows your breathing rate, which gives each breath time to actually ventilate your lungs. It engages your diaphragm, ensuring deep breaths that reach the lower lung zones where oxygen exchange is most efficient. It creates back pressure in your airways that keeps them open longer, preventing collapse. It activates your parasympathetic nervous system, which calms your body and dilates your airways. It helps you exhale fully, eliminating trapped carbon dioxide that's contributing to breathlessness. Within 3 minutes of doing this technique properly, most people experience dramatic relief. The consequences of not knowing this technique are serious. People who respond to breathlessness with panic and gasping often end up in emergency rooms or using more medication than necessary. The stress and fear of repeated breathlessness episodes reduces quality of life and limits activities. Some people develop such severe anxiety about breathlessness that they become sedentary, which actually worsens lung function over time and creates more breathlessness. The fear becomes self-fulfilling. But people who learn this 3-minute technique gain confidence that they can manage episodes when they occur, which reduces anxiety, allows them to stay more active, and ultimately reduces the frequency of episodes. Now let me teach you the 3-minute technique that can change everything when breathlessness strikes. This technique has 3 components that work together, and you'll practice all 3 in sequence for 3 minutes total. Component 1 is assuming the optimal position for breathing recovery. The moment you feel short of breath, do not stay in whatever position you're in. Instead, immediately move to one of these recovery positions. The best option is to sit down and lean forward, resting your forearms on your thighs or on a table in front of you. Let your shoulders relax downward and your head hang slightly forward. This forward-leaning position optimizes the mechanical advantage of your diaphragm and allows your lungs to expand more fully. Alternatively, if you're standing, find a wall or counter and lean forward with your hands braced against it, arms straight, letting your head hang between your arms. The key is getting into a forward lean position that takes pressure off your diaphragm and allows easier breathing. Component 2 is pursed lip breathing, which is the core of this technique. Once you're in position, immediately shift to this breathing pattern. Breathe in slowly through your nose for a count of 2. You're not trying to take a huge breath, just a comfortable, controlled inhale through your nose. Then purse your lips as if you're going to blow out a candle and exhale slowly through your pursed lips for a count of 4. The exhalation should take twice as long as the inhalation. The pursed lips create resistance that keeps your airways from collapsing and creates positive pressure throughout your lungs. This back pressure is crucial because it keeps small airways open that would otherwise collapse during breathlessness episodes. Continue this pattern. In through the nose for 2 counts, out through pursed lips for 4 counts. Don't force anything. Don't take big gasping breaths. Just slow, controlled breathing with the emphasis on a long, slow exhalation through pursed lips. If counting to 2 and 4 feels too long at first, start with 1 and 2, then gradually extend as you're able. The goal is to slow your breathing rate down from the rapid, shallow breathing of panic to about 8 to 12 breaths per minute of deep, effective breathing. Component 3 is conscious muscle relaxation combined with the breathing. As you continue the pursed lip breathing pattern, actively relax your shoulders, allowing them to drop away from your ears. Relax your jaw, which many people clench during breathlessness. Relax your hands, which might be gripping tightly. With each exhalation, consciously release tension from your muscles. This relaxation is important because muscle tension restricts breathing and signals to your nervous system that you're in danger, which perpetuates the stress response. As you relax, your breathing will become easier. Practice this complete technique for 3 full minutes. That means maintaining the forward lean position, continuing pursed lip breathing with the 2-count inhale and 4-count exhale, and consciously relaxing your muscles throughout. 3 minutes might seem long when you're struggling to breathe, but it's the minimum time needed for this technique to fully reset your breathing pattern and calm your nervous system. Most people notice significant improvement within 60 to 90 seconds, but continuing for the full 3 minutes ensures complete recovery and prevents the breathlessness from returning immediately. Let me tell you about Thomas, a 72-year-old man with chronic obstructive pulmonary disease who was experiencing severe breathlessness episodes multiple times daily. These episodes were terrifying for Thomas. He would suddenly feel like he couldn't get any air. His chest would tighten, his heart would race, and panic would overwhelm him. He'd been to the emergency room 6 times in 3 months because the episodes were so frightening and severe. His doctors had adjusted his medications repeatedly, but the episodes continued. Then Thomas was referred to pulmonary rehabilitation where a respiratory therapist taught him this 3-minute technique. The therapist explained that Thomas's natural response to breathlessness, trying to gasp in more air, was actually making things worse. She taught him the forward lean position, demonstrated pursed lip breathing, and had him practice the complete technique while his breathing was still normal so it would be automatic when he needed it. The next time Thomas felt breathlessness coming on, instead of panicking, he immediately sat down, leaned forward with his arms on his thighs, and started pursed lip breathing. Within 30 seconds, he felt his airways starting to open. Within 90 seconds, his panic was subsiding. After 3 full minutes, his breathing had normalized completely without needing his rescue inhaler. Thomas was amazed. For the first time in months, he had control over his breathing instead of being controlled by it. Thomas practiced the technique daily even when he wasn't short of breath, which his therapist had recommended. Over the following weeks, he noticed his breathlessness episodes became less frequent and less severe. When they did occur, he could manage them confidently with the 3-minute technique. His emergency room visits stopped completely. 6 months later, Thomas was doing activities he'd given up months earlier because he had the confidence that if breathlessness struck, he knew exactly what to do. He described learning this technique as life-changing, giving him back his independence and quality of life. The key to success with this technique is practice. Don't wait for a breathlessness emergency to try it for the first time. Practice the complete technique, the forward lean position, the pursed lip breathing, and the muscle relaxation, at least once daily when you're breathing normally. Set a timer for 3 minutes and go through the entire sequence. This practice serves 2 purposes. First, it makes the technique automatic so you can access it immediately when panic tries to take over during actual breathlessness. Second, regular practice of pursed lip breathing actually strengthens your respiratory muscles and improves your overall breathing efficiency, which can reduce the frequency of breathlessness episodes over time. Many people find it helpful to practice this technique first thing in the morning and again before bed. The morning practice sets up good breathing patterns for the day. The evening practice promotes relaxation and better sleep. Some people also practice it during the day whenever they feel even mild breathlessness or stress, not waiting for severe episodes. This regular practice prevents many episodes from developing into full-blown breathlessness emergencies. Respiratory therapists and pulmonologists consider pursed lip breathing combined with proper positioning to be one of the most effective non-pharmacological interventions for breathlessness. Research studies have documented that this technique improves oxygen saturation, reduces respiratory rate, decreases the work of breathing, and activates the parasympathetic nervous system within minutes. Clinical trials comparing patients taught this technique to those who weren't found dramatic differences in emergency room visits, rescue medication use, and quality of life measures. Emergency medicine physicians report that teaching this technique to patients in respiratory distress often calms the situation before medications even begin working. The technique is so effective that it's considered a first-line intervention for breathlessness across many conditions including chronic obstructive pulmonary disease, heart failure, asthma, and anxiety-related breathing problems. Physical therapists included in cardiac rehabilitation programs because it helps people with heart conditions manage breathlessness during exercise recovery. The insider knowledge that respiratory specialists share is that this technique works better than many medications for acute breathlessness management, yet almost no patients are taught it until they're in specialized rehabilitation programs. Primary care doctors often don't have time to teach breathing techniques during brief appointments, so patients suffer unnecessarily with breathlessness they could manage themselves if they only knew this simple intervention. Here's something that will change how you think about breathlessness and your ability to control it. Research studying the physiology of pursed lip breathing has found that it doesn't just help during episodes, it actually retrains breathing patterns over time. People who practice this technique regularly develop more efficient breathing even when they're not consciously using the technique. Their respiratory muscles strengthen, their breathing rate naturally slows, and their airways become less reactive. The revelation that surprises many people is that the majority of breathlessness episodes can be managed without medication if this technique is applied immediately and correctly. Studies have shown that patients who master this technique reduce their rescue inhaler use by more than 50% on average. Some people who previously required frequent emergency care for breathlessness stop needing emergency services entirely once they learn to manage episodes with this 3-minute intervention. Your breathlessness might feel uncontrollable, but with this technique, control is possible. When you master this 3-minute technique and experience its power to restore your breathing during episodes, the psychological transformation is profound. The fear that dominates your life when breathlessness can strike unpredictably begins to fade. You develop confidence that you can manage episodes when they occur. This confidence allows you to be more active, more social, and more willing to engage with life rather than restricting everything out of fear. People who successfully use this technique describe feeling empowered instead of victimized by their breathing problems. They feel capable and in control rather than helpless and dependent. The reduction in anxiety about breathlessness often leads to fewer episodes because anxiety itself is a major trigger. The positive cycle replaces the negative one. Less fear means less breathlessness, which means even less fear. Quality of life improves dramatically when breathlessness becomes manageable rather than terrifying. We've covered the 3-minute technique that can change everything when breathlessness strikes. Assume a forward lean position, either sitting with arms on thighs or standing leaning against a wall, to optimize breathing mechanics. Practice pursed lip breathing with a 2-count inhale through the nose and 4-count exhale through pursed lips to keep airways open and promote efficient ventilation. Consciously relax your muscles, especially shoulders and jaw, to reduce tension and signal safety to your nervous system. Continue this complete technique for 3 full minutes to restore normal breathing and prevent immediate recurrence. The question isn't whether this technique works. Respiratory research and countless success stories prove it does. The question is whether you're going to learn it and practice it now, before the next breathlessness episode strikes, or whether you're going to continue responding to breathlessness with panic and ineffective gasping that makes everything worse. Here's what you need to do today. Right now, find a comfortable chair and practice this complete technique for 3 minutes even though you're breathing normally. Feel how the forward lean position affects your breathing. Experience how pursed lip breathing creates that gentle resistance. Notice how muscle relaxation enhances the effects. Set a reminder to practice this technique at least once daily, preferably twice. Make it as automatic as brushing your teeth so it's available instantly when breathlessness strikes. The next time you feel short of breath, you'll have a powerful tool that can restore your breathing in 3 minutes. This technique has helped thousands of people regain control over their breathing and their lives. It has prevented countless emergency room visits and reduced dependence on rescue medications. It has transformed terrifying episodes into manageable challenges. 3 minutes of practice today could change everything the next time breathlessness strikes. Make the choice now to learn this life-changing technique. Your breathing, your confidence, and your quality of life depend on it.